Hi, my name's Liv from Work It Health. We're a digital recovery provider. You can find more information about us at workithealth.com. This is part of our community event. We are talking about perspectives on harm reduction. I'm joined by Wheelock, Elizabeth Brico, and Tracey Helton. So let's just kick off with, jumping to a question. Can you, by way of introduction, just tell us how you got involved in harm reduction and your experience in the field? Haven, do you want to go first? No pressure.
Sure, I totally will go first. Hi, everyone. I'm Haven Wheelock. I've been working direct service with people who use injectable drugs since 2002. I have a long and complicated history that I don't often dive into too much, but I come to this work really from HIV. I started doing HIV prevention work. So actually I should say, I run a syringe services program and a harm reduction services program in Portland, Oregon. I also have a master's of public health with a focus on overdose and addiction policy. I have been doing direct service with clients since 2002. I've been involved on the policy side and promoting harm reduction policy, both in our state, primarily for our state. So I was involved in our Naloxone legislation, our Good Sam law, and most recently, Oregon's effort to decriminalize all substances, small amounts of all substances, Measure 110. So that's kind of who I am. I come to this work from a background of HIV. I started doing HIV prevention work in 1989 as a junior in high school, mostly because I like talking about sex and drugs and it pissed my parents off that I like talking about sex and drugs so much. But I really did find my heart and my passion in syringe exchange in 2002. I was working in a syringe exchange service program there in New York City, and I fell in love with people who use drugs. They're my favorite people on the planet, and I really working to like dismantle the mythology that people who are using substances are somehow not full, complete, autonomous people was just something that like warms my heart, and to be present for people and show up for people and help them learn to like be their healthiest, happiest self, regardless of what substances they may or may not be using, is just something that I feel honored and privileged that I get to do. Tracey, you want to go next?
Sure. I'm Tracey, otherwise known as Tracey Helton Mitchell. So I got involved in harm reduction as a participant in the syringe exchange program in San Francisco, California. I was injecting heroin and other drugs in the late 80s and the early 90s up until 1998. And so I was a secondary syringe exchanger myself for a youth exchange program here in San Francisco. And I became very invested in harm reduction, specifically overdose prevention, when I got sober in 1998. So during that time in San Francisco, there was what they had considered to be an overdose crisis, which, thinking of the scale of that compared to what we're dealing with now, it's just mind-boggling. But so I started working and doing overdose prevention in 1999. And then I worked at the first city-sponsored Naloxone program in 2003. And so I've been in and out of working in various harm reduction projects, with my main focus being overdose prevention. And I've been running a Narcan program for my house, a male-based program, since 2013. But I think importantly, I've been an advocate for people who use drugs, specifically people who use opioids, women who use opioids, and then also an advocate in the abstinence-based sort of community spaces, because I see my abstinence as an extension of harm reduction, because I personally have proven to myself numerous times that I can't use drugs in a way that's not completely chaotic. So I do a lot of advocacy on that level, including I wrote a book and do media appearances and stuff like that. But I just think that A lot of things have definitely changed, but there's definitely a lot of room for improvement. So I am very vocal about that.
Thank you. Elizabeth?
Hello, I'm Elizabeth Brico. I'm a writer, a journalist, and a drug user with a history of IV opioid addiction. So harm reduction is something that has personally kept me safe and healthy throughout that period in my life. And now, even though I'm not using IV drugs anymore, the substances I do use help me. Harm reduction helps me with that. A lot of times we associate it with IV drug use only, but it applies to everything, including the coffee I had this morning, because we have that safe and regulated because of harm reduction that our country has allowed us to have. And I also cover a lot of issues related to drug policy and other issues that are kind of related, either directly or indirectly to harm reduction and drug use, such as the prison industrial complex, the foster industrial complex, and different issues like that. And so most of my kind of harm reduction work centers on sharing information and helping to center people who use drugs in this narrative and shift the narrative away from some of the old kind of harmful tropes that tell people that people who use drugs are dangerous or ignorant or all sorts of ridiculous things that are not true.
Can I just jump in one quick? You mentioned drinking coffee. Actually, the handles on coffee and tea mugs are one of the oldest harm reduction interventions that there are. They've been around forever. And it keeps not only does it keep your hands from getting burned holding your cup, it also keeps your dirty fingers off your cup.
It's amazing. I didn't know that. Thank you.
Fun fact.
I'm so honored that that you've all come together to talk about harm reduction. You know, you've all got really amazing perspectives that, you know, I feel like the world and the recovery movement would benefit from hearing. Speaking of recovery, I feel like harm reduction as a concept has more recently been co-opted by the recovery movement. I'm curious about your thoughts about that, and also curious about, you know, what are the elements that are, you know, and initiatives that are of harm reduction that are being overlooked in that practice?
I can speak on that a little bit. That's such an interesting question, and one that I have so many thoughts on, but I'll try to trim them down right now. I appreciate in some ways that harm reduction has entered the kind of recovery community. You know, I take buprenorphine, which is a form of harm reduction and recovery. I mean, it can be used in other ways, but like I think it's totally valid to take buprenorphine without being in a recovery context, but it is also used in a recovery context and it's harm reduction. So without those combinations, I wouldn't have that really crucial like support in terms of abstaining from IV opioids, which is something that I want to do right now. But there are also ways in which some manifestations are harmful of harm reduction in the recovery community. And I think it's when those communities don't fully embrace like harm reduction as a whole, because I don't think I've ever met like someone who's a harm reductionist who doesn't say abstinence is a valid choice and is on the spectrum of harm reduction. But I've definitely met recovery people who claim to embrace harm reduction, but also say that you need to have abstinence as your goal. And I was actually in a buprenorphine program that was like that ended up causing me more harm than probably any other treatment program has ever done in my life, because they ultimately kicked me out for getting sick and missing a few days, which they like assumed was me relapsing without even like administering a drug test or anything. And even if it had been me relapsing, like that's absurd, because if someone is on buprenorphine and they have a relapse, that means they need more support, not to be kicked out. But they called themselves a dialectical abstinence program and claimed that that meant they were incorporating harm reduction into an abstinence-based program, which is like absurd, and it did not work. You know, so that is something that concerns me. I really, when recovery programs choose to be harm reduction oriented, I think that's amazing, but it needs to truly be harm reduction oriented. And that means supporting people where they are at, like for real, like not just saying that. Like I had a counselor who was like, I was having difficulty giving an observed urine test, which is, I'm a sexual assault survivor. That's an extremely invasive procedure, you know, having to like take your clothes off and urinate in front of someone. And when I was having the difficulty, she was like, this is where I'm willing to meet you. Like, I'm willing to let you try more than once, but that's it. And so she used that term, like, I'm going to meet you where you're at, but only if you come over here. Like she used she knew the term, she used the language, but she wasn't doing it right. And that's pretty common, I think. So I think that's where it's troublesome, is when programs kind of take the language of harm reduction, take part of the ideas of harm reduction, but then weaponize them into like this really stringent, punitive, abstinence-based model. But that said, I want recovery programs to utilize harm reduction, and I just want them to utilize it for real.
So I have a lot of thoughts, but I'll distill them down to just like a couple different things. So when I started going to 12-step programs in 1998, they said people on psych meds weren't sober. Like that was very common. I had a sponsee who was on psych meds. She was encouraged to get off of them, ended up in, you know, the psych hospital. And so things have changed. Like there has been a lot of like movement in the abstinence community toward change, but a lot of it has been forced by like things that have happened and that have made them, instead of being responsive, it's very reactive. So a lot of the abstinence-based programs have had, treatment programs have had people overdose and die after they kick them out in the middle of the night. There have been lawsuits, there have been various things where they've had to accept change. A lot of the high-powered recovery advocates that you see on Facebook and different apps have been, told that they can't work if they won't, at least say something positive about harm reduction. So there's not full buy-in from a lot of people. It's a lot of lip service. So I think public health programs, there has been a lot of change where, public health is like, this is what you're doing and you're going to have to adapt to that. I live and work in a city where it's harm reduction is the city policy. And so the treatment programs, the abstinence-based treatment programs have to have some form of harm reduction as part of their programs. But still we're so far behind. And so I think, that a lot of it is being driven by people saying, if I quit heroin, I smoke weed. If I say I'm in recovery, I'm in recovery. If I quit my drug of choice and I have a drink every now and then, like the whole attitudes from the public are changing. And so people are trying to adapt to that. And it's becoming more positive for people to say, like, my relationship with a certain drug is not working, but I'm going to try something different, or I'm going to go on MAT, and I don't care what you think. But, but still people's attitudes, the things that come from some of the people and in the recovery community are still very dangerous. Some of the advice, because it's not based on anything but advice, like my personal opinion. And so a personal opinion is not evidence. A personal opinion is not science. And so, you have to tell people, like, if you choose to go to these programs, if you choose to go to 12-step and you're on MAT, people are going to say things to you that are based on their opinions, not science. They're not, people might say things that are harmful to you. So you have to think about that. Other people are very, are willing to embrace that, but we're still in like this in-between period. But I think the reason why harm reduction has been co-opted by part of, the recovery movement is because that's where the money is. That's where the movement is moving towards. That's where the money is. I can't stay in the dark ages. I'm being forced to change. But you still see this pervasive attitude of still not, well, they're not really sober. Well, they're not, it's like, but like I own that word, like I own the word recovery, like a person owns the word recovery, and I can define what it is based on my perceptions. And that's problematic. Those are my thoughts.
David?
I guess for like, as somebody who's been like doing this for a long time, I'm so excited. Like, and I guess I'm like, I'm a glass half full kind of person. I'm like a we're gonna change the world kind of person. And do I trust the recovery community to back harm reduction? The answer is no, I don't. Like for so long, the recovery community talks shit about harm reduction in a really concrete, really like actively fought against it for a long time. It's going to take some time for me as a harm reductionist to trust that you're actually on our team. And like the things that have already been said about like, they're there in lip service, but not really showing up for people. Like that's, prove it. Prove that you're on our team. I want you. Just show me you mean it. And then I'll believe you. And like that, doors open. I also think that like, you know, we've spent so long vilifying people who use drugs. Anytime we can bring folks in and build a bigger, stronger net for humans, because what works for me in my drug use is not going to be the same that works for Tracey, is not going to be the same that works for Elizabeth, it's not the same that works for you, right? Like it's all going to be different. And I want all the tools in the toolbox, right? Like as a harm reductionist, I regularly send people to 12-step meetings, right? Because if nothing else, you can meet people who aren't doing drugs there, right? I also do that with warnings and like, because the safest way to do drugs is to not do them. That's the safest way for most drugs. Some things are just safe in general, LSD. But in like, yeah, I think I want the recovery community, like I want us to be one team. I want that. That's the goal, is that we're one spectrum of care for individuals who use drugs, right? Are we there yet? No, we're not. And there's some repair and some learning and some unlearning that all of us have to do around that. I hear a lot of harm reductionists talk shit about 12-step programs too, right? Like we got to unlearn all of that if we're going to provide enough tools to create a spectrum of care for people who are using.
And I'm curious if we want to name those tools. You know, we're talking about harm reduction in such a broad sense. Like, do we want to name the continuum of harm reduction initiatives? You know, from needle exchange. I mean, do you want to, Haven? Do you want to?
Sure. I mean, there's so many tools, right? Like, I mean, so, and this might get a bit into like radical harm reduction history and stuff, but like people who use drugs have always taken care of each other, right? It's always been a network of humans who will do what they have to do to survive, will take care of each other, right? Like, so I think we often, like, it was radicals. It was drug users. It was people with lived experience that started the first syringe exchange programs, right? That started the first and currently are operating overdose prevention sites, safe injection facilities, call them what you want. I call them all the things, but you know, that was all done by the community itself in an effort to take care of each other. I think often when like public health people talk about harm reduction, they're talking about syringe exchange, they're talking about naloxone, they're talking about like soap and water. When I talk about harm reduction, like there's the tools of harm reduction, right? MAT is a tool of harm reduction. And for folks that don't know, MAT is medicine to treat addiction. Currently, we just have them for alcohol and opioids, but hopefully someday we'll have them for more things. Safe consumption spaces, drug checking services, those are all tools to help promote people to be happy, healthy, and not dead. But I think the most important tool is kindness and respect, right? Like harm reduction only works when you're able to like be kind to people, to show up for people, to show people love even when they're being assholes. Because I'd like to say everyone's always really nice in the syringe exchange. They're not. I got my window broken this morning. But it's that unconditional positive regard, that like belief and hope that people and like, it's not just hope. I know people's lives change all the time, right? I've been doing this for almost 20 years. Like, I have so many dear friends of mine who I did their first HIV test, which is also harm reduction, right? That were clients for years and now are like not using and living a happier, healthier life for them. And yeah, if we can't do that if we don't show up. Did I miss anything? You guys also know stuff about tools of harm reduction. Did I miss anything?
So I would say one of the biggest tools has to be around reducing use. Like the first, I never go to just stop. It's always around, well, try cutting back. Try, what are other things that you like to do? Like, it's when you take away, so everyone's using drugs for whatever reason they're using them, because they feel good, because they had trauma in their life, because they're replacing stuff, whatever it is. You can't just take something away from someone and give nothing back. So the process of reducing harm frequently is literally is reducing your use, however that is. So we don't use it that much in the United States, but a lot of countries, instead of going straight to 12-step, they do moderation management, which is, if I want to quit drinking, the first thing I'm going to do is I'm going to look at how much I'm drinking. I might not even know. I'm going to log how much I'm drinking. I'm going to look at how much I'm drinking. And then I'm going to decide, what if I only drank when it feels good to me? What if I only drank in social situations? What if I cut back my use? And the same thing can be said for smoking or using drugs. Or what if I only use meth when, I have the ability to eat, sleep, and have a place to stay, instead of like having it be a super chaotic experience where I can enjoy the experience more. But really part of harm reduction is looking at the reasons why and respecting the relationship that you have with the drugs. So, and I think that's where, in the abstinence community, you're basically in some way told, like, that's great that you have that, but now we're starting on a new page and we're just kind of closing the door on that. And I think that doesn't work for a lot of people. And 12-step isn't the only abstinence program. There's Life Ring, which is another one, which is not based around spirituality or whatever. There's Smart Recovery, which is sort of a harm reduction mix with abstinence, depending on what your goals are. There's other things out there, but I think in terms of harm reduction, it's looking at it's respecting people as having reasons why they do the things they do, and trying to like get in there and keep you safe while you're in this process, and respecting that, and respecting the reasons that people exist. And we, it's like, when I was homeless, if you would have came to me and told me just stop using meth, it's like, why? I have to stay up all night. Like, there's no reason for me to stop. There's no reason for me to do these things. And so it's a process for people. And for a lot of times, being in terms of like recovery, it's not a linear process. It's just not like I go from A to Z. It's I bounce all around. Well, I'm trying this now. I'm trying that, and I'm gonna try something different, tomorrow. And so, working with people along the way, along the continuum.
Yeah, and I also want to add too that harm reduction, like I just feel, I know everyone here probably knows this, but I just feel like I want to explicitly always say this everywhere, that it's not just for people who want to stop using or who want to moderate their use. Harm reduction is for people who want to continue using too. It's like, that is the spectrum. And I think it's really important to acknowledge that it is for people who want to abstain. It's for people who want to moderate their use. It's for people who have no desire at all to stop. And maybe never have a desire to stop, and that's fine too. Or, I mean, there was a point in my life when I didn't think that I was ever going to want to stop. So someone could say that, like, stop using heroin, and someone could say that and then change their mind later, or they may not. And harm reduction is for everyone. And also, harm reduction is a lot of things besides just the things like Narcan needle exchanges, like physical health. Like, it's also like emotional well-being, it's mental well-being. It's physical well-being in other ways, like helping people to not be incarcerated, making sure that communities of color and other communities that are disproportionately impacted by systems that affect people who use drugs are being centered and heard and treated in a culturally and community respectful manner. And I think that actually is something that really needs to be like explicitly stated more, because there are some harm reductionists out there who don't realize or don't see the importance of that. And something also that this is like my big thing is like, we need to make sure that systems like the Foster Industrial Complex, like the Prison Industrial Complex, are recognized as being systems of harm for people who use drugs specifically, and that abolishing these systems, that targeting these systems, that helping people stay out of these systems and exist outside of these systems and away from these systems is also an aspect of harm reduction, and not just a minor one, like an integral one. Because if you have someone who's being constantly getting felony charges, or even just one felony charge in this country right now, can destroy someone's life in many different ways, can stop them from getting jobs and housing and all sorts of issues. Child services involvement is like, it is life ruining, as I've personally experienced. I mean, I've been lately referring to myself, like Elizabeth Brico, the journalist, as having been executed by the state of Florida, because my children were taken from me, my rights were terminated, essentially just for having a history of drug use. And that was my, I mean, when you're a parent, that's your life, you know? So like, if you harm someone because of their drug use in that way, it never goes away. So we need to make sure that that is included in the spectrum of harm reduction, like explicitly and across the board, like everywhere.
Thank you. I think that's such an important point. I think we always make that assumption that anybody who uses drugs will eventually want to stop doing that. And yeah, I think that's a common misconception in recovery. Do you think there are any other misconceptions or myths that are out there about harm reduction?
There are so many. I will just say I mean, because we have 100 years of living in the war on drug users, right? There are very few people, I don't know ages of who's on this call, I don't want to assume, I don't know that any of us remember a world pre-war on drugs, right? And because of that, because of that, we've got the stigma, the dehumanization, the vilification, the criminalization of people who use certain substances, right? Not all substances. I drink alcohol, smoke cigarettes, and marijuana rarely, and caffeine literally all the time. But we have this vilification. And so in people's brains, because harm reduction doesn't say drugs are bad and doesn't say the people who do them are bad, I think a lot of people's ideas of like what these spaces are and how they feel and like are really askew. Like the number of times I've had non-drug users come into our space and just be like, I can't believe how loving this space is. Like everyone comes in and it's, thank you so much. Like not everyone, the guy that broke my window. But you know, like I hear more thank yous and I'm so happy to be here. I'm so happy to feel seen in the syringe exchange that I run than I ever did bartending, than I ever did working in the service industry, right? Because people are used to being treated like shit and now we're being nice to them. I got so many like heartbreaking and lovely and wonderful stories, but literally at least once a day, someone will tell me the only place they feel safe in our entire city is in our space. And that's heartbreaking. And it makes me really proud of the work we do and like why we do it, because I want people to feel safe.
I'd say the biggest myth is that harm reduction is enabling. And that's the pervasive myth that we're constantly dealing with. I think also that, you know, racism is such a big part of the war on drugs, and somehow in harm reduction, the resources are still not distributed equally. And so really that this is like a colorblind move. As it's moving into the recovery spectrum, it's getting away from being a radical social justice movement that's working towards the needs of people of color, people who've been incarcerated, people who've been in carceral systems, including it's becoming almost whitewashed to a certain extent to make it more palatable for another audience, when really it's like, when I was started sending Narcan through the mail, I was worried they were going to arrest me. Like, this is not, now it's like Narcan, people, everyone knows about Narcan, but I was like really concerned, and I didn't care, because it was social disobedience. It's like, this is what I'm doing. Like, a lot of people who did this work were, they got arrested and still get arrested. They're still getting arrested for doing this work, handing out condoms, people handing out condoms to sex workers and being put in jail. And a lot of that work was being done by sex workers who were giving out condoms. And so we're not enabling where it's these are health issues that we're dealing with. But as harm reduction becomes something that's more packaged for the general public, a lot of like the radical intentions and the beliefs behind it sort of become muted, and which is unfortunate.
Thank you. Elizabeth, do you want to add anything?
I just like second everything Tracey said, like that enabling thing. I've seen and heard that so many times, and it's so frustrating that there is this like idea that that offering harm reduction is enabling, because it's not, it's enabling people to live. But that's like a common like response, but it's not like enabling in the sense of like making someone use drugs. Like, I can tell you, as someone who did IV drugs in a state with a lot of harm reduction services and did IV drugs in a state with virtually none, having access to the services and having no access to the services did not affect whether or not I was using, but it did affect how safely I was using. I reused needles when I was using in the place where I couldn't get them easily. Whereas when I was in Seattle, which has a ton of harm reduction services, like I didn't need to do that really, like I could just go get what I needed. And not like that wasn't a deciding factor though in my use. Like, and I don't know anyone for whom it ever would be. Like, if someone is going to use, they're going to use, and helping them use safer, it's just going to help them live. In Florida, which like has almost no harm reduction services, I had a good friend who ended up dying from endocarditis because he didn't have access to sterile syringes. And a lot of people down there are really recovery oriented and kind of had the mentality like, well, it was because he used that he died. It wasn't because he used that he died. It was because he didn't have access to the equipment he needed to use safely. That's why he died. If he had that stuff, he may still be alive. And maybe he would have gone back to recovery, because I know that was a goal of his, but he never got the chance to get there because he didn't have the equipment he needed. So I think that I know that Tracey already said all this, but I just think it's worth like emphasizing, like, it's not enabling drug use. It's just enabling people to live.
Thank you. I was going to ask about, about the stigma of needle exchanges, but I feel like we've touched on how critical a service that is. Is there anything you want to add to that conversation?
I'm going to jump in because I've got my public health nerd hat on. And I think, and I don't know that it's been explicitly called out, I think one of the things that annoys me the most with the recovery community and the conversation around harm reduction is the lack of conversations about the like for real, tangible, terrifying, deadly health consequences that can come when people don't have the things that they need, right? Like, I think we're really quick to like silo things into buckets because that's how the money comes in, to be honest, right? Like, that's how we pay for services, is to have these buckets. I get the HIV money, the overdose prevention money, the like substance use disorder money, like, and braid it all together to keep things up and running. But, I think kind of to like what Elizabeth was saying, like harm reduction services are about disease. And we see things like Scott County, Indiana is a great example. 5 years ago had the worst HIV outbreak ever documented in the United States amongst injection drug users, right? In a little over, I think it ended up being like 160 cases. The CDC had to step in. Mike Pence had to pray about it. And before they would open a syringe exchange program. And now, right, cases went down, people are getting care. However, they're fighting to stay open right now, right? Like I think the last time, like on one of my harm reduction listservs, there's like probably 4 different court cases trying to sue syringe service programs and harm reduction programs to get them shut down across the country, right? Santa Cruz is another example of a program that operated for 20 years and got shut down. Although I think they're back up and running, but don't quote me on that. So, I mean, I think there are many places throughout the country that have zero access to these services. The federal government still won't let you use federal funds to buy syringes. And so, you know, when we forget, like, I'm sorry, if I wasn't offering syringes and naloxone, clients aren't coming in for the drop-in space. Like, these concrete tools are what lures people into the juicy, yummy, like sweet spots, and like allows for those interventions. And I think we do need to be talking more about, I believe, the public health and the systems issues, right? Like, our healthcare system has been horrible to people who use drugs for a very, very, very long time. There's a reason people who use drugs don't trust healthcare. And syringe service programs and harm reduction service programs may be the only place that people get any health information, right? So it's not just about like people's drug use. It's like the number of times I've like gone to doctor's appointments with participants because they were scared to go alone is unbelievable. And like, someone comes in with a sore throat and they're an IV drug user, it's not their drug use that's causing their sore throat, right? People who use drugs sometimes get strep throat too. And so like, but having someone that like they trust to be like, hey, will you look at this? And my answer is, I'm not a doctor always, but I do like, I think it's the health information, and like, I'll sit down with someone and show them how to like find a vein and like, you know, those kind of things. I will make sure people have the things that they need to not get HIV, not get hepatitis, hopefully not get skin and soft tissue infections, although it can happen. Like the case of endocarditis, which if people don't know, endocarditis is a infection in the lining of your heart. It's really dangerous. It's really deadly. And, you know, like that stems from somebody being afraid to get care. That's how that happens. Like it starts as a skin infection or like it turns into a blood infection, and then it lands in the heart. And so I think one of the things that often gets forgotten, especially in the recovery community around harm reduction, is that it is a health intervention. It's not necessarily like, you don't get to send a peer into the syringe exchange to like fish people out for your recovery programs, right? Like we're here for so many other complicated, complex, beautiful like interaction around health and wellness. And some of that is sobriety and some of that is not.
So just to speak to that point, so I've had 34 abscesses. I've had all the HEPs, A, B, and C. It used to be actually called non-A, non-B when I had it. A lot of my friends died from HIV, and I watched them die because there was no antiretrovirals and there was no resources available for them. And I've been, I've been sober for 23 years now. And so I assume a lot of the people from Work It Health, you get to the point, like you have to decide how you're going to do your recovery and what your relationship to your drug use is. But for me, it was just the constant health consequences of using drugs and like having people help me with that. The first year I used IV drugs, I used the same syringe. It was used by me and multiple people. It was just, and we used to sharpen it with the matchbook like that. And that reality in 2021, there are still places in the United States where people are still doing that because there's no resources. And so, you know, for me, I was saying it'd be easier for me to cop fentanyl to get into treatment. Like I can go get 7 different types of drugs 20 minutes from my house. I mean, not even that really, but you know, there's so much going on, and with fentanyl and the drug supply, it's so dangerous. And so we are, you know, dealing with so much trauma and so much suffering right now. And like getting onto Matt is actually, you know, it's not just harm. It's like, there's just so much to it. It's like, it's possibly saving your life so you don't have an overdose if you decide that you're going to use drugs or whatever. And that is critical, and that should be respected. If the only reason that I get on Suboxone or whatever form of buprenorphine is because I don't want to overdose and die, then that is valid, and respecting that as a choice, and whatever other health consequences. And that to me is the essence of harm reduction, is you know, keeping people safe while they get some opportunity to enjoy their life, however that looks. Like, what, you know, life is for living. And so whether it's abstinence, which is in my case, or whether, you know, whatever it is for people, I just hope that if you get nothing else from this talk, that you know, we need to respect the lives of people who use drugs and their choices. And so, no, if you were to ask people who knew me that if I would be the person who'd be alive today, absolutely not. Like, I was very risky. I've shared needles. I did all the terrible, dirty water. I've lanced my own infections, like all the different things. But I had these people when I would go in places that would say there's alternatives, there's other things that you could do. There's, you know, and they would help me with that. And that really stuck with me. So even though my primary job is doing something totally different in the mental health field, like this is what I do. Like I have no spare time. Like this is what I do is really try to educate people because it's critical, because lives are literally on the line right now.
Thank you, Elizabeth.
Oh yeah, I mean, I'll be quick. I just wanted to kind of like piggyback on that and just say that I see such like a contrast too, like in my experience, having been an IV drug user who started in like the 2010s in Seattle, Washington, versus someone who started kind of before harm reduction was so widespread, or even people who started somewhere else, like Florida. As I talked to people when I was living in Florida there have been multiple people that I have met in places like Florida who have been completely shocked that I had the opportunity ever in my life to just walk into a building and be given free syringes. They didn't even know that existed in this country at all. And that's amazing. Like, I feel I didn't like know this until at the time, but I was so incredibly lucky to begin using IV drugs in Seattle at the time I did, because harm reduction was just there. Like, it was just something that I always knew about, like the basics at least. You know, I always knew you don't share syringes with people. I always had access to get them, so I didn't have to. You know, I always knew, like, I just knew I knew you had to cook your water. Like, I just knew those like really basic things that, like, I met people in other places who didn't know them. And it wasn't just that like they were desperate, because, like, you know, that can happen. You can be really sick, you can be desperate, you can be in a situation where you don't have a lighter, you don't have your own syringe or something. But there were people who actually just didn't even know these things. Like, they just didn't know them because they were never taught that, because they didn't have access to harm reduction services. And that was in this country, the same country. Like, it's just, it's really mind blowing to me, honestly, like that they can be so different, like between just like different states or counties. But I just think that really highlights like what like harm reduction does. Like, the fact that I right now used IV drugs for roughly a decade, with some like periods in that of abstinence, and didn't come out of that with a bloodborne illness, and had like one significant abscess in that entire time. That says a lot. Like, that speaks to harm reduction, and I think that that's really important to know.
Thank you. I think there's so much stigma around needles, and and I'm curious too if this also translate to the use of naloxone. Do you think that's the case? Like, people are kind of hesitant to use the injectable one versus the nasal spray. Why do you think that is?
I have, oh, go ahead. I have a couple ideas. I think one, people are much more comfortable with naloxone than they are with like syringe access or overdose prevention, right? I think universally, like at this point, people are like, oh yeah, naloxone, it's an important tool. It keeps people from dying. That's pretty accepted, I think, in general. Syringe access is a little more. When it comes down to the like injectable versus nasal naloxone, I mean, I think people are in general squeamish of needles, like all people, right? Not any particular, like in general, needles are scary. And public health has done a really terrible job of talking about, like, honestly, about the risk of discarded syringes and the risk of syringes in a community. I just finished training on this. It's discarded syringes are litter and they're gross, but they're not a threat to public health the way not having access to syringes is a threat to public health. The injectable naloxone, a lot of times people say that the syringes may be triggering to people. We hear that a lot. They're very different syringes. Like, yes, some people do use IM syringes to inject with. Most people do not. They're two different types of tools. So that's one thing we hear a lot. The other one, I also think nasal's just, if it was as cheap as injectable, it is easier to use. I have reversed probably 40 overdoses in my career. And I will say the nasal is easier to use. It doesn't involve drawing things up. It does, like, drawing up liquid into a syringe when your adrenaline's pumping and your hands are shaking, even though I teach this for a living, that's what my body does at every overdose I've ever been at, is trickier, totally doable. In an overdose situation, I'll use whatever I got. But it is easier to push it up the nose. I've had parents tell me, like, oh, I'm terrified of getting, I don't want injectable naloxone because I don't think I can do it. And then I've had like one mother call me back and be like, I was scared about giving someone an injection until my kid wasn't breathing. And then it was like, there are bigger, scarier things. So I don't know if other people have thoughts.
Yeah, what I was gonna add is just that when I've interviewed people on this topic, like for my journalism, there have been some people who have cited like concerns or like actual like issues with the syringe laws, because syringes aren't like fully legal everywhere. So that's like some people don't want to have like syringes on them because they're worried they may get arrested. And I think it's even actually happened. Like, people have gotten arrested for having those syringes. Also, I don't know, but if this is the thing, I imagine it probably is, but there may be some people who hear injectable naloxone and think it's like IV and they're gonna have to like find a vein, but it's actually IM, it's intramuscular, so it's not all that hard. But I imagine that some people may think that they'd have to like go and find a vein, and that would be very difficult in an overdose situation if you don't know how to do it. So I think those are two big things. I have never personally used the IM naloxone. I've reversed a couple of overdoses and they were always with nasal Narcan, but what I have heard is that one of the benefits is that you can gauge the dose, so it's easier to of IM naloxone, so it's easier to give someone enough to revive them but not enough to make them sick, whereas Narcan is already pre-measured. So if you need to give someone that second dose, you may end up putting them in precipitated withdrawal.
My typical protocol is one of the 4 milligram naloxones and then wait and then switch over to IM, because I can, just for that reason, I can titrate it in a way that's less likely to be cruel to other human beings.
Thank you. I'm conscious of the time because we've got a few minutes left. I want to see if anyone that's watching has any questions, and if you just enter them in the Q&A box and we will get to as many as we can. And while we're waiting for that, I thought it might be helpful to talk about resources. So, you know, how do people get access to naloxone? You know, let's say they want the nasal one. How would they get access to that? And any other, you know, vital service that we've been talking about?
It really depends on the state. I mean, I'm just going to be honest. It depends on if you have insurance, your state. I mean, I live in California. California has a grant that pays through Next Distro. You could go to nextdistro.org. They do. I'm on their board of directors. They do primarily naloxone distribution, but some states have programs that pay for Narcan. Some places don't. Some places, there are a few states that will pay for, even New York State and California will pay for full harm reduction kits, including syringes, fentanyl test strips. Some states there's absolutely nothing, and not the states you would necessarily suspect. So it's really, it really depends. I would say if you're searching information about drugs on the internet, a lot of the stuff that's on there is actually inaccurate. If you look, I would search multiple sources and compare the different things that they say. Like, especially, I mean, even stuff that they say, like if you're interested in you know, the Bernie's method for induction for Suboxone at home, there's good YouTube videos on it, but sometimes if you read like personal accounts of different things, they're completely wrong. So I would look for respected sources if you're trying to find resources out there. I wouldn't go necessarily by people's personal accounts. I mean, when I was using drugs, people would say, well, if someone's having an overdose, shoot them up with cocaine, put ice on their ball. I mean, there's things that are just not true. You know, people are waking up because of the stimulus. So, you know, so I would just say, take information that you find with a grain of salt. You know, a lot of people you can contact me if you're trying to find naloxone and you can't find it. Tracey H415 on all social media. I link people to naloxone every single day, pretty much. But I just really want to put that out for anybody that's watching. Do your research, don't just go with the first thing that you find compared to other sources.
I will also, like, I think, I don't know how up to date it is. There's like OD Maps is a great source for different programs throughout the country that are distributing naloxone. The North American Syringe Exchange Network, NASIN, if you're looking for, if there are syringe exchanges in your community, NASIN is a great avenue to try and get information. The National Harm Reduction Coalition, harmreduction.org, has great information. They're also really responsive. If you're like, hey, can you help me find a thing? That can be a useful source as well. But it does vary a lot, state to state, insurance to insurance, like all of those things. So pharmacy to pharmacy, like even Oregon was one of the first states to say pharmacists can sell syringes to anyone, and it's still, Target just opened up the road and the pharmacy called me to make sure I knew specifically that they will not be selling syringes. So you know, that variability is there. And Tracey, you're absolutely right. Like, there's a lot of great information on the internet, and there's a lot of weird information on the internet. But I do think OD Maps, NASIN, and the Harm Reduction Coalition are like a great jumping off point for anyone who's curious to learn more.
Great, thank you. Elizabeth, do you got anything to add?
I'll just add, not necessarily related to physical things, but if you or someone you know is a drug user, there is something in definitely the continental United States. I'm not sure, possibly all of the United States. There's a service called Never Use Alone. And if you Google that, like, I don't have the number right off the top of my head, but if you Google that, you can get the phone number. It's a phone number that someone who is using can call if they don't have anyone with them. And it's not related to like any government organization or anything. It's pretty much, I believe, drug user run, or at least harm reduction people run. And you can call them, they'll like stay on the line with you while you use your drugs. And then if you become non-responsive, they'll send emergency services. Unfortunately, right now, the only option they have is to send 911, but that's better than dying. So it's a good service if you have no other option, like you have no one with you who can help. So I just wanted to add that, never use alone.
Thank you. Well, that brings us to the end of the panel. I mean, I could talk to you folks all day. I've really enjoyed this. Any parting remarks? Oh, puppy.
There has to be an animal in every single.
Yeah.
So I just thought Buster volunteered as a tribute.
Oh my gosh, so cute. Well, thank you everyone so much for your time. I really, really appreciate it.